Hi, Brittany. My name's Sam. How are you doing?
I'm good. How are you?
Good. What brings you in today?
Just for my weekly or monthly physical. yearly. It's a yearly physical.
Okay. Well, that's great. I'll assess you. What's your Can you just give me your name and birthday?
Brittany McNeil, July 25th, 1991.
All right. Well, thank you. Okay. So a few things before we get started. I phoned in. I've provided privacy. I've closed the door. I have all my equipment. I've kind of observed the appearance of the patient just walking in, and there's no obvious physical deformities. She has good hygiene. Her clothing is appropriate for the season. It's warm outside. She's clean. She's alert. She makes eye contact whenever she's speaking to me. And I've kind of looked at her skin color. I'll look at that throughout the whole exam, but there's nothing abnormal just by looking at her. And so first I will look at your hands, and I'm just feeling they're warm. Her color's good. And I'm looking at her nail beds, making sure they're flat, and she has good cap refill on both. So that's good. And then she's oriented ×4. She knows where she's at. She knows who she is, everything like that. So first we'll do your head. I'm just going to look at your scalp, and I'm just looking for any lesions, making sure it's not tender. Then I'm going to kind of feel around where your skull would be and making sure there's no soft spots. Don't have any, that's good. And then I'll do your temporal pulse. That's strong. And then I'm just going to touch your sinuses. Is that hurting? Is that tender?
No.
Okay, good. And then can you open your mouth? So I'm feeling her temporal mandibular joint, making sure there's no popping or anything like that. And then I think that's it on the face. Her face is also symmetrical. That's a good thing to note. Her eyebrows are the same height, her eyes, and her mouth. And so then we'll move on to her eyes. So I'm just kind of looking at the structures of her eyes, the conjunctiva. There's no excessive tearing or anything. Her sclera are white. There's no yellowing or redness. And her pupils are round. They're probably about 3 millimeters, so that's good. And then her iris is also circular. And so I'm just going to have you test your peripheral vision. So just tell me when you can see my fingers.
See him.
Okay, good. And then I'm just going to have you follow my finger. So we're going to go in 6 directions. Make sure there's no shaking or anything. Okay, that's good. And then we'll check your reaction to light. I'm going to shine the light in both eyes twice. Looking at each eye, making sure they're symmetrical. Doing the same thing. Okay, that's good. And now I'm going to have you look at my pen light.
Okay.
And then look behind me.
No?
Mm-hmm.
Oh.
Okay. Okay, and then look behind me. And then look back. And then look behind me again. So I'm just looking and making sure her pupils are constricting when she looks at my pen light, and that they're dilating whenever she's looking behind me, which they did, so that's good. And then I believe that's it on the eyes. For the Snellen chart, I won't physically demonstrate it, but I would have her stand 20 feet away from the chart and have her cover one eye and have her read the lowest line that she can, and that number on that line would be over 20, and that would show her visual acuity in that one eye, and then do it in the other eye because the eyes can be different. And I will also do one more test. So I'm going to have you look behind me at the M on the wall and cover one eye, and just keep looking at that M. So I would really watch for a full minute, but I won't for demonstrative purposes. But I'm just making sure that our eye is not quivering to keep focus, which it's not. It's staying completely steady. So then cover that eye and leave the other one uncovered and do the same. So she's not having trouble focusing on it or anything. All right, that's good. So that would be the cover test. And so then we will move on to her ears. So I'm just kind of looking at the external structures, making sure there's no drainage or anything excessive, no lesions, which there isn't. And then with the otoscope, I would pull back her pinna, and I would put the otoscope in the ear canal, look, and I would be able to see all the way into the tympanic membrane, making sure that all the structures are intact, and I would also do that in the other ear. And then I'm going to do the whisper test, so I'm just going to whisper 3 words, and you're going to repeat them back to me.
Dog, mouse, cat.
Good. So then I would do both of those things, looking with the otoscope and doing the whisper test on the other ear as well. And then I will go to the nose, just making sure that it's symmetrical, and I'm going to have you look up, and I'm going to look inside your nose. And so I would really just be looking at the septum and the mucosa and making sure that everything's intact, no abnormal discharge or anything like that. So then we'll move on to the mouth. So I'm just going to have you open your mouth. And I'm going to look at her cheeks, making sure there's no lesions or anything, looking under her tongue. And her teeth are straight, they're white. Her gums are pink and moist. And I'm going to have you stick your tongue out. I'm going to look back at her tonsils. They're not inflamed. They look to be normal, so I would say that those are probably a 1+. And can you stick it out and say ah?
Ah.
And are you just moved, so that's good. And that's it with that. And so now I'm going to look at her neck. So I'm just going to feel her carotid pulses. Okay. Making sure there's no abnormal pulsations. There's a little pulsation, but that is normal around her trachea. And then she doesn't have any venous distension, which is good. And I'm going to kind of come behind you. I'm just going to feel your trachea and thyroid. Make sure that it's midline. Can you swallow? Okay, and you can feel that, and that's normal. That's good. And you can see her shoulders are symmetrical, her posture's straight, her neck is symmetrical, there's no lesions or anything, and I'm just going to kind of feel around where her, what are they called? Her lymph nodes are. Make sure that they're not sticking out, or I can't feel them, so that means that she probably doesn't have an infection or anything abnormal there, so that's good. So then we'll move on to her chest. And so I'm just going to kind of put my hand here and make sure that when you breathe, it's symmetrical expansion. So that's good. And I'm just going to kind of palpate. Is it tender? Anything?
No.
Okay, so that's good. So I'm going to listen. So I would listen in the inner 1/3 of her clavicle. So if you could just take a deep breath when you feel my stethoscope. And then get the second intercostal space on each side. And then the 4th. And then the 6th. Okay, and so her anterior breath sounds are both clear, and so I'm going to have you turn around, and I'll do the sounds on the back. So I would do at T1, both sides, and then T3 right at the top of the scapula, then T7 right at the apex of the scapula, and then T9 lateral to the vertebral line, then T9 on the posterior axillary line. Okay, so her lung sounds were clear also on her back, so there's not any evidence of whispered proliloquy, bronchophony, or egophony, because they were clear. So nothing abnormal there. So now I'm going to just listen to her heart. And I'll listen with both the bell and the diaphragm with my stethoscope. And then I'm gonna listen her apical pulse for a full minute. So her pulse was 82 and it was regular. And so real quick, I'm gonna just kind of percuss her chest, make sure there's no abnormal feelings there, which it feels normal.
Sorry.
Okay. And I'll check her turgor, make sure she's hydrated, which that was rapid, so that's good. And so then next we'll move on to her upper extremities. So I'm going to palpate her radial and brachial pulses. So they're strong and equal. Those are also strong and equal. I'm going to have her grip my hands. Okay, and then I'm going to test the range of motion in your shoulders, arms, and wrists. So I'm just going to have you remove your wrists in a circle. That's good. And then bring your arms in. And then shrug your shoulders and roll them back. Okay, and then hands out in front and then turn them over. All right, so she has good range of motion. I'm also going to look at your neck. So if you want to look to the left and then to the right and then up and down. She has full range of motion also in her neck. So then I'm going to move on to her abdomen. So I'm going to have you lay down. Okay, so I'm going to pull off your shirt. So I'm just going to look at it first. It's symmetrical. The contour is flat. The skin throughout everywhere. Her arms and her belly are warm and dry, and it's current with her ethnicity. There's no patches or anything. So then I'm going to listen. Yeah. Listening in all 4 quadrants. Okay, so her vowel sounds are active in all 4 quadrants, and then I'll also listen at her aorta for pulse. Which I can hear. So that's good. There's no abnormal pulsations. Her stomach's rising evenly with inspiration. And so next I'm just going to palpate lightly first. Are you feeling any pain anywhere?
No.
Okay. Palpate deeper. Is there any pain?
No.
Good. Okay, so then now I'm going to go to the wide upper quadrant and I'm going to feel for her liver and kind of feel for all of the borders. So it feels a normal size, so that's good. And then I'm also going to feel for where her spleen would be. Hopefully I won't feel it, which I don't. So that's good. Alright, and that's good for your abdomen. So you can sit back up. And then I'm going to look at her lower extremities. So, let's see here. I'm just going to
Move this back some.
Okay, yeah, we'll move this back. So,
Do you want me to stand or sit?
this is good. So I'm just gonna kind of feel, make sure there's no edema or anything. She doesn't have any varicose veins. I would usually, look all the way up the leg. And she doesn't have any hair. It's all shaved. And then, so I'm gonna feel for her popliteal pulse behind her knees.
You want to see my feet?
Yeah. So that's strong. That's good. And then her
I can't see you.
posterior tibial.
You need to bring it up.
Okay.
Can you see him now?
Yeah. Posterior tibial are strong and equal, and then her dorsalis pedis on top of her foot is strong and equal. And then I'm gonna have you sit down. And I'm just gonna have you push up on my hand.
Oh, wait. I'm going to touch the ground for this.
And then push down. So the range of motion in her ankles are strong, so that's good. So now I'll just have you stand. Okay. So then I'm gonna just test her reflexes in her knees. So those are good. And then I'll have you stand up. And so can you just bring up your knees so she has good range of motion in her hips, and then bring your feet back. Knees are good, and then I'll have you squat, do a deep knee bend. Okay, good. So she has full range of motion in her knees, so that's great. So we've tested all those areas, the ankle, knees, and hips. So then I'm gonna just have you walk. Perfect. Well, you just walk, okay, and then walk back in front of the screen. So she's walking, her posture is erect, her gait was steady. So that's all within normal limits. So we can sit back down. And so then we will do the range of motion in her spine. So we will have her stand back up. And I'm going to have you bend forward. So we're going to test for scoliosis. And make sure her spine is aligned, her hips are even. So that's good. And you can stand back up. And then just move back just a little bit, bend. Good. So her spine also has range of motion, no signs of scoliosis. So then we'll do the Romborg test. So she'll stand up. I'm sorry.
Okay.
And I'm just going to have her close her eyes. And just have her stand there. I would usually do it for a full minute. And make sure that she's not swaying. This is a test that they do sometimes if they suspect that someone is intoxicated. Also, it can just show if there's any brain problems with equilibrium. So as long as she's not swaying, she's staying pretty still, she'll pass the test. So that's negative. So you can open your eyes. That's good. Now we're moving on to the neurological. And you can sit down. Okay. So first we're going to do the Babinski reflex, which will be in her foot. So we'll just angle the camera down a little bit.
Do I need to take my sock off?
Yeah, let's do that. So we'll take off her sock, and just with a hard object, I'm going to start at her heel and move up and make sure that her toes are not fanning out and that this doesn't move too dramatically, which it did not. So that's good. So that's the Babinski reflex. And then now we will do rapid alternating movements with your hands. So we're just going to go palm, just like that. So they're symmetrical. She's going at a good pace, so that's good. You can quit that. And then now we'll do the finger to nose test. So I'm just going to have you touch my finger wherever it moves, finger to nose. Whichever, start wherever you want. There you go. Okay, so she has good depth perception. Good job. And so now we'll have her kind of sit straight, and we're going to have her touch her heel to her shin. Alright, so that's good. Perfect. No neurological deficits there. So now I'm just going to kind of test the sensation in her face. Can you feel me?
Mhm.
And then can you feel me poking you?
Yes.
Okay, so we'll do like light and then poke. You can feel both of those?
Yes.
Okay, and then we'll do hands. So you can feel that.
Mhm.
And you can feel poking.
That's great.
Okay, good. And then we'll do your legs. So can you feel me poking you?
Yes.
And you can feel that.
Yes.
That.
Mhm.
Poke.
Yes.
Okay, and then I'll do the same in your feet. Feel that.
Yes.
That.
Yes.
That.
Yep.
Okay, good.
Okay.
So now we're going to do some more reflexes. So we'll do your brachioradialis first. So I'm just going to kind of tap here right at her wrist and see her brachioradialis move, and the elbow might flex just a little bit, which it does, so that's good. And then I would also test that on the other side, obviously, which I am not going to do. And then now we'll test her Achilles tendon. So yeah, that's good. So then her toe is going to flex just a little bit, but only slightly. So I'm going to touch that.
Hold on, I'm flexing.
There you go. Okay. That's good. Okay. Good job. Okay, the
I
toes.
keep flexing. I'm sorry.
Okay, the toes moved that time, so that's good. So we want the toes to just move up slightly.
I kept flexing it.
Okay.
Okay.
So all of her reflexes were normal. And so that concludes our assessment. Do you have any questions?
No, I do not.
Okay. So everything really was within normal range. There was no abnormals throughout any of her assessments, so I wouldn't need to refer her anywhere. So that concludes the assessment. Thanks.